Hi, and welcome to the Unmasking Depression, your existential psychoanalytic toolkit mini course. My name is Nikki Venera Brenner, and I'm a registered psychotherapist and own a group private practice called The Mind People. I have created this mini course to help spread awareness about mental health, to educate people on topics including depression, and provide some helpful strategies that can help improve your day-to-day life. We've got 4 modules lined up, each diving into the essence of depression, the psychoanalytic perspective, and the existential angle. Together, we're going to unravel the mysteries of depression and why understanding depression is a crucial first step. Before we dive in, let's make it crystal clear. This mini course is not a replacement for therapy. It's an educational tool to boost your understanding. Remember, seeking professional help when needed is essential. Before we talk about depression, let's differentiate between sadness and depression. Sadness is an emotion, just like happiness or anger. It's not inherently good or bad. It just is. Your emotional state is like your choice of beverage, coffee or tea. Neither is good nor bad in and of itself. We're going to break down what depression is. We'll explore the distinction between sadness and depression, talk about safety concerns, and discover why knowing about depression matters, whether for your own well-being or to help others. Sadness can reside on a spectrum. Some people can feel down or low due to some situational issue, or maybe that person woke up on the wrong side of the bed and just feels off. Other people can feel intense sadness or despair. Additionally, one's intensity and frequency of their sadness can fluctuate during the day, week, and month. Did you know that even if you feel intense sadness and it has been lingering for days, weeks, or even months, that your emotional state alone does not suggest you are depressed? You might be thinking to yourself, that doesn't make sense. If I feel sad more often than I feel happy, doesn't that mean I'm depressed? No. The term depression is a clinical term used by healthcare providers, such as clinical psychologists and psychiatrists, which ultimately involves labeling a cluster of symptoms. So, in order for a healthcare professional to diagnose someone with depression, such as a diagnosis of major depressive disorder, otherwise known as MDD, then the individual must present with certain symptoms that align with a diagnosis of MDD. If you feel sad most of the time, experience a loss of interest in activities you once enjoyed, otherwise referred to as anhedonia, experience changes in weight and or appetite, sleep disturbances, feelings of guilt and or shame, worthlessness, hopelessness, suicidal thoughts, restlessness, irritability, impulsivity, loss of energy, difficulty focusing and or making decisions. These symptoms have been present for at least 14 days, and the symptoms have impaired your daily functioning. Then based on these criteria, as outlined by the Diagnostic Statistical Manual, 5th edition, TR, then these endorsed symptoms are likely to fall in line with a diagnosis of MDD. It is important to understand the difference between sadness and mood disorders like MDD because sadness is a typical human response. We all feel sad sometimes. And based on our history, who we are, and what has happened to us, we will experience sadness more or less intense than someone else in a similar situation. However, it is atypical to endorse symptoms of depression, and if you did answer yes to the MDD criteria outlined just a moment ago, then it will be in your best interest to seek professional help. Individuals who suffer from depression may also experience suicidal thoughts. Individuals who suffer from depression and do not seek help, either via therapy, the use of a distress line, community resources, and/or medication are more likely to experience negative consequences, including emotion dysregulation, the urge to self-harm, and ongoing thoughts of suicide. Let's now discuss the ways in which you can keep yourself safe, which includes identifying and noticing your triggers and warning signs. Triggers are situations, thoughts, or feelings that can lead to an increase in suicidal thoughts or behaviors. They can vary greatly from person to person and may include stressors like relationship problems, financial difficulties, hopelessness, or even certain anniversaries can be triggering. It's crucial to recognize your triggers, as understanding what sets off these triggers is the first step in managing them. Okay, so let us take a moment to pause here. Get a sheet of paper or type in your phone the triggers you have identified just off the top of your head. Now, keep this document and continue to add to it as you build insight into your personal triggers. This will be helpful for you to visually see what your triggers are. You can pause the video here. Thank you for taking the time to write down your triggers. It's important to recognize your triggers so you are equipped at de-escalating the situation. When talking about common warning signs of suicidal ideation may include withdrawing from loved ones, giving away personal belongings, increased substance use, drastic mood changes, and even talking about feeling like a burden. Let's pause here again. Get another sheet of paper or type in your phone again the warning signs that you identified off the top of your head. Now, just like your document outlining your triggers, keep this document as well and continue to add to it to start to understand and notice when you are starting to spiral. Pause the video here. Thank you for identifying your warning signs. It's important to identify your warning signs so you can be mindful of when you are feeling a loss of control. You can also provide your list of warning signs to your loved ones in your circle of care, so they too can help you keep yourself safe. Now, let's dive into the protective factors. Protective factors are elements in your life that reduce the risk of suicidal thoughts or behaviors. They can include strong support systems, a sense of belonging, effective coping skills, and access to mental health care and resources. For example, protective factors can include seeking emotional support from a loved one, cuddling with a furry family member, such as the family cat, thinking about your positive goals and aspirations for the future, use your coping techniques and/or skills, the use of a safety plan, as well as contacting a crisis line. Let us take another brief pause here. Now, I would encourage you to think about your protective factors. When thinking about your protective factors, think about healthy things that make you smile, which might include a funny movie, or interesting book, or an interesting person. Take a moment to think about what some of your protective factors are, as well as how you can strengthen them. Pause the video here. Thank you for sharing your protective factors. It's important to build on these strengths to enhance your resilience in times of distress. The process of identifying, exploring, analyzing, and understanding your triggers, warning signs, and protective factors involves a mental skill called mindfulness. Mindfulness is a learned skill that helps you pay attention to what is happening to you in the present moment. More so, mindfulness is a building block into the process of introspection. Introspection refers to the exploration and examination of your own mental and emotional processes. Introspection helps you to build insight and unlock the secrets buried in your unconscious mind. This is important because the more in which you learn about yourself, your past and present self, the more equipped you are at establishing a genuine and confident sense of self, which can have a positive effect on your relationship with yourself, others, and positively influence how you show up in the world. For example, research suggests that the ongoing practice of mindfulness can aid in reducing stress, enhance focus, and you can feel more energized. The practice of mindfulness, such as mindfulness meditation, involves focusing on you, your thoughts, your feelings, your behavior, your experiences, and your perception in the present moment. However, mindfulness does not have to be limited to meditation. You could do your laundry mindfully. For instance, you can focus on the smell of the detergent and try to decipher what you smell, how the clothes feel in your hand, soft, smooth, rough, covered in mud if you have kids. What do you see? What colors do you see? You might want to be careful with this one doing laundry, but what do you smell? You can start by using your senses to explore what you see and then let your mind wander. Mindfulness techniques can help you become more aware of what has happened and what is happening to you. It involves being fully present in the moment and observing your thoughts, feelings, and behaviors without judgment and without expectation. Okay, let's talk about how you can keep yourself safe. So this is important. To begin, let's focus on safety planning. A safety plan is a personalized, step-by-step guide that helps individuals cope with suicidal thoughts, manage emotional distress, and access supports when needed. It is a crucial tool for those who are at risk of self-harm or suicide. A safety plan is an effective suicide prevention strategy because it equips individuals with the skills and the resources to address their emotional struggles and crises before they escalate to a dangerous level. By following the plan, individuals can learn to recognize warning signs, engage in self-soothing techniques, reach out to a crisis line, and/or go to the nearest hospital when in imminent risk of suicide. Your personalized safety plan can act as a lifeline during moments of vulnerability. Take a moment to locate the safety plan template in the resource folder below. You can download this template and fill it out or modify it to suit your needs. Take the time to create your personalized safety plan, which is a form of self-care. Lastly, let's talk about imminent risk. If you find yourself in a crisis situation or you are finding it difficult to keep yourself safe, it is crucial to take imminent action. This may involve seeking help at a hospital, contacting a crisis line, using other crisis resources, and/or using your personalized safety plan. Why is understanding depression so vital? Well, it's because we need to dive into the existential psychoanalytic perspective, which can help us build insight into the driving factors behind the reported depressive symptoms. Without proper treatment, whether it's self-help, using a distress line, going to your nearest hospital, taking medication, or seeing a therapist, without these proper treatments, the consequences of depression can be far-reaching, affecting your relationships, work, and your physical health. In this module, you learn the basics of what depression is and why understanding it is a fundamental step towards self-care. This module also addressed what mindfulness is and how mindfulness can help improve your well-being. We discussed what a safety plan is, how to create a safety plan, and what imminent risk is. You also have access to the safety plan template in the resource folder below. So for your reading pleasure, here is a list of references that I used. If you are interested in doing more research, you can pause the video here and take note of these resources that are most appealing to you. You have now completed your first module. Congratulations! You are now educated on the fundamentals of depression. Thank you for participating in your first module. The second module, we will dive into more information about the psychoanalytic components of depression. So stay tuned.